I actually love this question because we tend to focus so much on the threat that we forget the overall promise of AI. So when people say AI will transform healthcare, I think they're missing the human piece.
And from what you see on the ground, being in it, are healthcare teams actually ready to use these systems? Or do you think we're building faster than we're preparing people?
If you are somebody who is leading a healthcare organization today, you have to realize that you aren't just managing a digital transformation, right? You're managing a human one. Right? Well, I think if we don't certify or train our people, we're essentially giving them a car with no driver's license, right? So the risk isn't just them driving slow or that slow lap. The risk is a total crash, right?
Hello, and welcome to the Better Health Tech Podcast, where we explore how technology can actually make healthcare smarter, simpler, and more human. I'm Shelby Soto, and I've spent the last 15 years working in the intersection of marketing technology and product growth, helping organizations turn digital strategy into real outcomes. I understand both the strategy and the execution behind modern health and tech growth. And AI is moving so fast in healthcare. We're seeing automation in workflows, AI in diagnostics, preventative analytics, and even decision support systems being rolled out across organizations. But here's the reality most people don't talk about. Technology is evolving faster than the workforce is using it. Healthcare teams are being asked to adopt complex systems without always having the right training, certification, or operational readiness behind them. And that creates a real gap, a gap between what technology can do and what teams are actually prepared to handle. Because at the end of the day, AI doesn't replace the systems, it depends on it, and the system depends on people. So the real question is, are we building AI-ready systems or AI-ready people? And today's conversation is all about that missing layer, the human side of healthcare transformation. I'm joined today by Dr. Kengia, CAHIMS certification coach, RHIA, PMP, CAHIMS. She works closely with professionals and organizations to help them get certified, build workforce-ready programs, and prepare teams for modern healthcare systems. And today we're going to connect the dots between AI, workforce readiness, and why certification still matters more than ever. Dr. Kengia, welcome to the show. It's so great to have you here. I think before we get started, I would love just to, have you share a little bit about who you are and your background, if you wouldn't mind.
Thank you, Shelby. I'm really excited to be here because this is such an important topic. About me, as you mentioned, I dubbed myself the HIM certification coach. I am the CEO and founder of The Qualified. We help individuals get certified, stay certified, and find their place in the healthcare industry. So like you, I previously, before starting this, I was in academia, but before academia, I was in healthcare leadership. I worked as the director of medical records at my local healthcare system. And I did that for about 10 years before I transitioned into academia.
That sounds impressive. Well, today, let's start simple. When people say AI will transform healthcare, what do you think that they're missing in that statement?
I actually love this question because we tend to focus so much on the threat that we forget the overall promise of AI. So when people say AI will transform healthcare, I think they're missing the human piece, as you mentioned earlier, because that's what's required in order to make these that transformation actually happen. So, I think you're right when you say AI will transform healthcare. Let's say, for example, if AI allows a patient to get diagnosed months earlier because it spotted a pattern in a lab result, or if it helps the clinician start treatment days sooner, that's a massive victory, okay? That isn't just a transformation, that is a life saved, okay? And I think that should be the goal, right? But here's the piece, again, that gets overlooked in the AI craze. Okay, and this is in my humble opinion, of course.
AI, no, this is great. Yes.
AI is only as good as the data that we feed it. So if the health information is messy, if it's biased, if it's poorly governed, then that quicker diagnosis could also be a wrong diagnosis, right? So to get to that better version of healthcare, we need HIM professionals who are certified and are ready to ensure data integrity. We need the ethics and the governance to be the guardrails for the speed in which we're adopting AI. So it's not about AI replacing us, it's about AI requiring us to be more precise than ever so it could actually do the good that it's capable of.
Right. That's very, very true. So we're seeing massive amounts of investments in AI right now. It's what's trending. And from what you see on the ground being in it, are healthcare teams actually ready to use these systems? Or do you think we're building faster than we're preparing people?
I want to say that's the $1 billion question, right? Because that's how much they're investing in AI. But, I can't speak for every healthcare system, but I can tell you what I see on the ground, right? I personally think that we are absolutely building the plane while we're flying it. And that's not a good thing. I mean, there's certainly, innovative healthcare systems that's leading the charge, especially locally where I live. But for the most part, the gap between the technology being sold and the workforce ability to manage it, I feel like that gap is widening, right? We are seeing massive capital investments in software and technology, but we aren't seeing a mirrored investment in the human capital, right? That's going to be required to run these technologies. So, if you, let's say, for example, you had a hand, if you had a hand surgeon, right, and you gave them a high tech robotic tool, but you don't invest in training for the entire surgical team, you haven't necessarily improved care, right? You just increased that risk. And not every healthcare system will see it that way. But imagine if we just took a small fractions of those billions of dollars being poured into AI startups and invested it into our people, right? Our communities, our local community colleges. That's where the real transformation is going to happen, right? If we've invested in those grassroots efforts and those pipelines, we wouldn't just be reacting to AI as if I feel that we are now. We would be building a workforce that's ready to lead it from day one, right? So I think, in my humble opinion, we need to stop treating workforce readiness as an afterthought and start treating it as it's the primary infrastructure for that innovation that we're looking for.
Oh, that's so great. And I wish more people were, leading this and talking about it, but that's exactly why we're here today. So you kind of touched on my next question, which is everybody talks about what AI can do, but what are the risks when the workforce is not properly trained or certified?
Well, I think if we don't certify or train our people, we're essentially giving them a car with no driver's license, right? So the risk isn't just them driving slow or that slow lap. The risk is a total crash, right? We see it in denied claims, we see it in data breaches, and most tragically, we see it in the potential for patient harm, right? So, certification isn't a luxury. And I tell people that all the time. I like to say it's more so an insurance policy for the safety of our patients, for the safety of the data and information, and for ultimately the survival of our organizations.
So well said. That was well said.
Thank you,
With
Shelby.
AI relying, it is. You couldn't have painted a better picture for that. So, with AI relying heavily on data, accuracy, compliance, and structure, where does HIM fit into this new AI driven ecosystem?
Oh my gosh, don't get me
I feel like
started.
it's, I know.
Okay.
That was a, yes.
So, first of all, HIM is the data, period, right? We are the integrity, we are the compliance, and we are the structure. So to me, it's not about being included in the conversation. And I think a lot of us, I mean, because that's just naturally how we in HIM we operate, right? We like to be the people in the background. So I think we're all waiting, like earlier I mentioned, not really talking about AI. We're waiting to be included in the conversation, right? But it's not about that. It's about recognizing that you cannot have a safe AI ecosystem without professional data governance. We are the stewards of data who ensure that the data is being used, that it's being used responsibly, and that the data is actually fit for the task in which we need it for. So if things go wrong, AI isn't going to be held responsible, right? The people governing that information will be. And that's why we must be at the table. We have to protect the data. We have to protect the organization. We have to protect the HIM profession. And then again, most importantly, we got to protect the patient.
Now leads into the next question. Some people feel certifications are outdated now, but in the world of AI, automation, and compliance, do certifications become more important or less? I think I know the answer here, but I want to hear your take on it.
Don't ask me that. I will never say certifications is outdated, but no, I don't hear that. I haven't heard that yet. And I'm thankful.
Okay.
Um if anything, I think the demand is higher than ever, right? Because we have to be honest. Just having any certification doesn't AI proof your career, right? It's about having the right certification paired with the right modern skills. I tell my network all the time, you have to find your foundational gold standard, like a CCS, like a RHIA, like a PMP, but you don't stop there, right? You have to be proactive,
Mhm.
So I'm personally, I'm trying to practice what I preach, right? I just signed up for the AI in the workplace MOOC through the College of St. Scholastica. So whether it's, taking the AAPC's AICEU or earning specialized credentials like the AIPHC from Comply AIQ, we have to lean into where the industry is going. So
Yeah,
certifications are valuable. I think they will always be valuable, but we have to make sure we're chasing the right certification.
makes sense. So if you had to fix one thing today, would you focus on better technology or better workforce training? And more importantly, this is loaded questions. Uh, why that choice and what impact does it actually create on the ground? So, would you focus again on better technology or better workforce training?
Okay, so if I had to fix one thing today, it wouldn't be technology. Sorry. I
Okay,
feel
no,
like the,
this is
the
good.
tech is already there. I feel like the tech is already here, right? And it's improving faster than we ever imagined, right? I would choose better workforce training, hands down. Okay, so as an educator, I see the gap every day. Traditional academic programs, they're vital, but they often face mountain loads of red tape and multi-year approval cycles, right? So by the time a curriculum is actually approved, the technology it's teaching might already be obsolete, right? So this is why agile workforce programs are so critical. Like they can move at the speed of the industry. And I think that's one of the things that's stopping us, right? These workforce
Mhm.
programs, they can pivot in months, not years, to ensure that professionals actually know how to use the tools that's being placed in front of them. So when you invest in training, you create this ripple effect or this domino effect that tech alone can't touch, right? You replace that tech anxiety with tech fluency. You reduce overall costly errors, you lower burnout because people actually feel competent in their roles, right? They want to work, they want to use the technology, and you ensure that the massive investment companies are making in AI is going to yield a return, right? But most importantly, I think when we invest in these programs, it empowers the person. right? Better training turns a job into a career and a worker into a leader. So we have to stop trying to automate people out and start training them to really lead the way in our industries.
That's good.
I hope that answers
Knowledge
your
is power.
question. Yeah, it is.
It did. It did, yes. So, in your opinion, building future ready teams, what should healthcare organizations start doing right now? If someone is leading a healthcare organization today, what should they start doing immediately?
Okay, so I'm going to say something that I don't think I've admitted to myself out loud.
Okay.
I really, again, I'm an educator, but I'm really feeling this urge to get back into the healthcare organizations. I just am. And I don't know if it's because I feel like we're at such a pivotal point and I want to be included, or because I have something to contribute. I'm not sure what it is, but I think that's where I'm being called to right now. But if you are somebody who is leading a healthcare organization today, you have to realize that you aren't just managing a digital transformation, right? You're managing a human one, right? And that's the part that I feel, again, gets missed. So the first thing that you should do immediately is try and close that communication gap. Communication isn't easy, right? And I understand when you're leading, healthcare systems and you're responsible for hundreds or thousands of people, but your leaders and your staff shouldn't be hearing about your AI strategy through a press release or a leaked memo. Okay. You need to bring them into the loop. You need to show them where the organization is headed, and you need to give them a genuine opportunity to grow alongside these changes, right? We have to stop looking at AI as a replacement for staff and start looking at it as a reason to upskill the staff that we have. Okay. If you are investing millions in technology, but zero in your people, you're building like this high speed engine with no one that's qualified to steer it. Right. So my advice is just going to be simple. Bring in the experts, right? Find some experts wherever they are. Don't wait for traditional academic cycles to catch up with the red tape. Partner with agile workforce programs and community colleges and universities right now to create a pipeline of talent that is tech fluent and that are certified. Okay. Because again, when you invest in your people, you replace their anxiety with ownership, right? You aren't just buying a software, you're building this culture that's again ready to lead. So I personally think that the greatest ROI in 2026 isn't found in a software license, right? It's found in the confidence and the competence of a well-trained workforce. So that's my little piece of
Great.
advice. That's it.
Yeah, that's great. And you kind of hit on the next topic about career advice. So the next question is, for professionals worried about AI replacing jobs, what should they actually focus on learning?
Okay. So, and thank you. You're absolutely right. It leads perfectly into that question. But going back to that, right? When we don't keep our people in a loop, that's what causes that fear, right? And they're thinking AI is going to replace me. AI is going to replace me because nobody has told them otherwise, right? That's how they end up in my inbox on LinkedIn. But I tell my network all the time that AI isn't going to take your job, but a professional who knows how to use AI, right? And who holds the right certification just might, right? So
Right?
don't focus on competing with the machine speed. You're not going to be able to compete with AI, right? We're not robots, but you got to focus on mastering the machine's use and that governance. So my advice is really to start today. Sign up for that course, get that CEU in AI, right? And don't wait for your boss to tell you that it's time to grow. We know when it's time to grow. We see when our industry is shifting, and we just can't avoid it. We shouldn't avoid it. So again, we just got to lean in, right? And make sure we upskill ourselves.
Oh, so great. The great advice. All right. So this next round is what we like to do towards the end. It's called rapid fire round. What it is, it's just short, sharp, and straight to the point answers. So it's a yes, no, I don't know.
Okay.
And we go to the next. It's called a rapid fire round.
Okay.
So, all right. AI will replace jobs, yes or no?
Both, but roles will evolve.
Great. One skill that will matter most in the next 5 years.
Data stewardship and data analytics.
Biggest mistake healthcare organizations are making with AI.
Under investing in their people.
Certification you recommend today.
It depends. Can I elaborate?
Good. Yeah. No, it depends is perfect.
Okay.
But go ahead if you would like. Yeah,
No,
absolutely.
again, certifications aren't one size fits all, and your goal will determine the certification that best supports your career. That's it.
Perfect. One role in healthcare that will grow the fastest because of AI.
I think auditors.
What should leaders prioritize first, technology or people?
People always.
One thing professionals should stop doing if they want to stay relevant.
Resisting change.
Amazing. I love all your answers. Great. All right. So for our closing question, if healthcare leaders are listening right now, what's the one mistake they can't afford to make when adopting AI?
Oh man. I think the one mistake healthcare leaders cannot afford to make is prioritizing speed over governance and stewardship. Okay. I think we are already seeing the fallout in the news with organizations that are using AI to generate clinical notes without patient consent. We can't afford that, honestly. So when you do that, you aren't just innovating, right? You're violating the fundamental trust between the patient and the provider, and that's not fair, right? If you bypass consent and governance just to save a few minutes on documentation, you're creating a massive legal and ethical liability that no amount of efficiency can justify. Okay. So in 2026, the public and the regulators are watching. So you can't automate empathy and you certainly cannot automate consent. So I think my message to leaders would be do not let the AI craze blind you to your responsibility as a leader. Okay. So if you implement these systems without a certified HIM professional at the table to ensure that the ethics and the governance are airtight, you aren't building, in my opinion, for the future of healthcare. Okay. You're building a healthcare organization of mistrust. And I think that's it.
Great. That's so great. Dr. Kengia, this was incredibly insightful. I could talk to you for the next hour.
Yeah.
It's up to me.
You too.
Yeah. So thank you for being with us. And just AI is so powerful, but without the right people, the right training, and the right structure, it doesn't deliver real impact.
Yeah.
And to everybody listening, if you want real practical conversations around healthcare technology, follow our page on Better Health Tech on LinkedIn or watch us on YouTube, listen to us on Spotify, and we'll see you in the next episode.
Thank you for having me.